one other question here to follow up. And I think you mentioned this right before we went live. So I think this was a few minutes before. So a lot of people probably didn't hear this, but the question is in the same vein. So you talked about telemedicine. I know you're seeing this too, Tom, on the insurance side, becoming more and more popular depending on what ailments you might have. But I think the question was during COVID times, you're not able to see certain doctors and people are not being treated for things they should normally be treated for, right? Because they're not going to the doctor, or they're not going to the dentist or whatever. But now telemedicine is an option for people who have challenges out there. Can you speak to that?
Yeah, so telemedicine and telehealth were rapidly becoming normal. It's a way to engage your doctor or your therapist anyway, but there were a lot of rules around how we could prescribe medications and how we could engage patients. A lot of really sort of old school restrictive rules that ultimately prevented us from engaging a lot of patients. And very shortly after COVID came out, the government basically said, we're putting all those rules on hold. Doctors, therapists, please go engage your patients as best as you can right now, because otherwise they're gonna have no resources. And it has been nothing short of fantastic, because we are able to treat patients that we otherwise would never be able to treat. I mean, something like 40% of my patients that make an appointment to come to my clinic to get treatment don't show up. Because between the time they make the appointment and the time the actual visit, something happens. These are very their lives are very often chaotic and unstable, and from hour to hour, circumstances can change. Now somebody can basically say, I want help, and they can reach out to us, and we can be on a confidential, HIPAA compliant platform with them and be basically treating them immediately. So what we call that is lowering the threshold or barrier to care and making it much more easy for the patient to get that initial treatment, because statistics show that once you've engaged a patient meaningfully, the chances of them doing well go up dramatically. I don't think this is ever going back. After COVID, I think the benefits are going to be clear that telemedicine and telehealth are here to stay, and it's going to be good for treatment providers and for patients both. You know, you have constraints otherwise, right? You have timing constraints, you have, you know, the amount of time you can spend with a patient is constrained. Patients are spending a lot of time trying to get to you, and this makes it all so much more seamless. There are trade-offs. I mean, there are certain things that when I'm face-to-face with a patient that I can see and pick up on that are hard to replace, but by far and away, the benefit outweighs the drawbacks in terms of us getting to engage many more patients much more easily, and patients getting to ask for help and get the help they need without a lot of barriers in the way.
How many steps are there, right? You gotta, who do I go to? Gotta find out who to go to. Then you got to make the appointment, and then you gotta physically go there. There's all these steps that are in place. And then, and you and I talk a lot about this, there's the stigma part of it. You're like, I don't want to admit that. I have to look another human being in the face and say, I have a problem. You saw this with erectile dysfunction. I mean, the last year and a half, you see these places now like Roman and these other companies now, You don't have to go to your doctor anymore. Look at your doctor, who might be your buddy, and go, hey man, I got some problems. You know, now you don't have to do that. You get on your phone, you get an appointment, private and confidentially in the comfort of your own home, and you admit, and you have something that can help you. It's no different with this, but I think a lot of people don't realize this. Prior to COVID, all those steps were still there. You still had to make the appointment and figure out who Dave was and get to Dave, and there's all those constraints, and now that's all gone. People don't realize that that's not always been there. This is something that's just come about in medicine just last 90 days, right?
Absolutely. Yeah, this has got, well, it's accelerated dramatically.